Epidermolysis bullosa is caused by mutations on genes on chromosomes 12 and 15, which code for a protein called keratin, which provides strength to the skin's outer layer.
EB is an illness that causes the skin to be fragile. The skin is so fragile it can be easily injured, causing painful blisters to form. EB has many symptoms. Symptoms include blistering of skin, deformity and loss of fingernails and toenails, internal blistering including on the throat, upper airway, stomach, intestines, and urinary tract, skin thickening on palms and soles of feet, scalp blistering, scarring and hair loss, then appearing skin, tiny white skin bumps or pimples, tooth decay, excessive sweating, and difficulty swallowing. If you have any of these symptoms, please contact your doctor immediately.
There isn't much information or reliable statistics when it comes to EB due to the rarity of the condition. According to the official site, Deborah.org, EB affects 1 in 2,000 births. This disease does not discriminate. EB affects every ethnic group, male and female, across the world. The most common type of EB is localized type, also known as EB simplex, which is the mildest form of EB. To give the idea of the severity of EB, 73% of individuals born with junctional EB have lost their lives.
So epidermolysis bullosa is inherited in 3 different ways, and there's also a version that is acquired. The first way is, of course, autosomal dominant, which we've represented here in a stick figure family drawing. The second way that it's inherited is going to be an autosomal recessive, and this is the junctional form of the disease, which is definitely more rare. This comes about when both the mother and the father are carriers for the disease. Thirdly, we have dystrophic epidermolysis bullosa, which may be dominant or recessive. And lastly, epidermolysis bullosa acquisita, which is an autoimmune disease of this particular genetic abnormality. This is acquired, it's not inherited, and it's also been known to be associated with Crohn's disease.
There is currently no known cure for EB. Therefore, treatment mainly consists of alleviating the symptoms. Treatment can be separated into 3 categories: home care, surgeries, and other treatments. Home care consists of swimming, which is a low-impact activity that people with EB tend to enjoy, cleaning skin regularly to help prevent infection, and following healthcare providers' advice when they have blisters, applying antibiotic ointment and wound dressing as needed, taking steroids when needed, such as having trouble swallowing, and any medication needed when they have an infection. It also includes eating healthy to help the body heal. Surgeries consist of skin grafts, dilation of the esophagus, which is basically expanding the esophagus with a balloon, repairing hand deformities, and the removal of cells that might develop in bulging areas. Other treatments include dental care, since people with EB tend to have a lot of dental issues, medicine to suppress the immune system when diagnosed with an autoimmune disorder, and gene therapy.
There is currently a lot of research underway trying to find a cure for EB. At a minimum, the research is focused on more effective treatments. Right now, there are 5 areas of study. The first one is inserting proteins directly onto the skin in order to keep the skin layers from losing their cohesion. This picture on the right is of an Injex needle-free injector, which is designed to inject into the skin without damaging the tissue. The second area of study is using gene therapy, applying corrected copies of certain genes to more severely affected areas of skin in order to regulate the production of skin cells. The third area of study is applying to the skin a certain type of cell known as fibroblasts, which are grown from a small sample of the carrier's skin. This treatment is designed to strengthen the skin and make it less vulnerable to abrasion. The fourth area of study is to stimulate the production of healthy and more durable skin cells by conducting bone marrow transplants. The fifth area of study is to identify safe and effective medications that can be used to accelerate the process of wound healing. As of now, researchers are optimistic about these areas of study, but none of these treatments are perfected.